those of you who are watching live, you can actually put it in the chat and I'll read them in a minute. I've had lots of questions already on my Instagram, so I'm going to start by going through those. I'm increasingly aware that so many of you have questions that you are finding it difficult to answer. So I thought this would be an opportunity to share some of my knowledge with you. Before I start, I need to obviously let you know that I cannot give you any individualized advice. This is just very general advice. So if you need anything specific, then obviously you need to see your healthcare provider. Also, just for your information, as many of you know, I'm a physician and a hormone specialist, and I've done lots of different medical specialties over the years, and now all my work is really related to hormones, but I think about them in a very holistic way. For complete transparency, I do no paid work with pharmaceutical companies at all, and it's very important for me that people know that. I don't have any financial investments or interests in any supplement companies or any other companies. I run a private clinic, and that really serves women who are very underserved in our NHS in the UK. But a lot of the work that I do through the clinic pays for me to have the Balance app to be free, to do to have a team that can help me with these sorts of things, and also my podcasts as well. And I think it's important for you to know that. So the work that I do comes from my knowledge and evidence as opposed to any conflicts that I might have. So I'm going to turn the chat on so that if anybody wants to ask something in the chat, then they're very welcome to. So let me just make sure that I've got that on the right. Okay. So I've had quite a few questions on my Instagram. So I'm just going to open up my Instagram and move away from this concept. Right, so there's lots of questions here. So I'm literally just going to talk through them in a very relaxed way so you can try and learn from different people's questions. I'm using Vagirex twice a week, but still very sore. So Vagirex is a local estrogen. It goes in the vagina. It's an estrogen tablet. The general prescription is once a day for 2 weeks, followed by twice a week. But it's an incredibly low dose. Some people that's not enough, and it can be used more frequently. But increasingly, like I've said before, and there is a YouTube about urinary and vaginal and vulval symptoms worth watching. Increasingly, I use prasterone, which is DHEA, which converts to estrogen and testosterone and is more effective than just Vagirex or Vagifem. Can progesterone help my 22-year-old daughter with ADHD? Possibly. Lots of younger people are deficient in hormones or have an imbalance in their hormones or changing hormone levels, especially progesterone. Increasingly, we find that when we give people the natural progesterone, very different to the progestin-only pill, then it can really improve their mood and mental health and ADHD symptoms. Testosterone can also help too. Thoughts on injectable estrogen versus patch or gels? I usually prescribe the estrogen as the estrogel as a patch or a gel through the skin. I don't use injectables. Injectables are usually synthetic, so they've been chemically altered. HRT with endometriosis, taking progesterone every day or half a month better, usually every day. I've done a YouTube live about endometriosis, but usually having the same amount of hormones all the time is better for endometriosis. What levels do you recommend? Well, it depends on the laboratories, it depends on the country and the units that are used, but this lady's got a blood test of 0.5, which sounds very low. We often do free androgen index, so we look at the testosterone, we look at the sex hormone binding globulin, and then we do the ratio, and the ratio should be between 3 and 5%. If a woman's ratio is less and they're feeling well, then we wouldn't increase the dose. But if the level is low and people are having symptoms suggestive of testosterone deficiency, we often give a trial of testosterone to see if that helps. What do you think about cyclical versus static HRT? I presume you mean continuous. It's an individual choice. Some people think that people should continue to have continuous, but that usually means bleeding. Lots of us don't want our periods. Some people feel better after just stopping the progesterone for a few days and then restarting it. It's very, very individual. Apart from uterine protection, what are the benefits of taking progesterone? There are lots of benefits. to progesterone for our mood, our brain, our heart, our bones, and so forth. And I have done a YouTube live about progesterone, so it'd be worth listening to it. On HRT for 1.5 years, added testosterone gel, which helped me. It's still no energy and extremely fatigued. It might be the dose and type of hormone needs changing, or there might be another reason for the fatigue. I always say to my patients, I optimize hormones in a physiological way and then wait, because you have to wait 3 to 6 months, and then see how things improve. Often we see people and their estrogen levels are low, their testosterone levels low, they're not fully optimized with their hormones. Having the Mirena coil is beneficial, but it's not going to have the same effects. It's a synthetic hormone in a very low dose. I've been on the pill Clara's HRT. I'm 61. What can I take instead? I feel great on it. If you're feeling great, okay, but Clara is a synthetic type of contraception, and it doesn't have the same beneficial effects on the heart, brain and bones. So usually we try and convert people to the natural hormones, but it's an individual choice. Of course, if you're feeling well and don't want to change, you don't have to. I can't get my GP to prescribe HRT. How do I challenge? Well, it's worth seeing someone else. HRT is first line treatment for perimenopause and menopause. Guidelines are very clear for that. It's very safe, it's very effective. So if you're not getting help, you should go and see somebody else. On HRT, higher dose, but my levels are low. Am I not absorbing often? And I have done a YouTube about doses and types of hormones and when we can increase. I have a benign ovarian cyst. Will taking estrogen affect it? No, not usually, actually, because all you're doing is topping up with the natural hormones. What's the best way to apply estradiol? Rub it in? I'm not sure if absorbing. Yeah, there's been all sorts, especially on social media, whether you pat it, whether you use the lid, whether you rub it in, whether you just leave it. Everyone's different, but usually any ways of getting it under the skin. So often people just gently rub it in under the skin. Sometimes the skin of the arm absorbs better than the skin of the leg, or vice versa. Or sometimes trying a different manufacturers. In the UK, we've got Estrogel, the pump, or we've got Sandrina, which is the thicker, it's slightly more viscous in a sachet. And some people absorb that better. Could you dive into migraines? What's the best dose? GP doesn't know. I have done a podcast about migraine, and it is really important having the right dose and type. Often patches are better because you have a smooth amount, so you're not fluctuating like you might do with the gel, and often testosterone can be beneficial for migraines as well. Usually we start very slowly and gradually increase, because any big changes can really sometimes trigger migraines, which you don't want. How long until periods settle after starting HRT? It can be 3, sometimes even longer, 6 months. And every time you change the dose or type of hormones, there's a risk of having bleeding. Is it safe to use Vagifem and vaginal estrogen cream together? And will the cream help with a vanishing clitoris? Well, yes and no, it might do. It's fine to use both because they're very low dose and they're different. Sometimes the cream's better to use externally, but it only contains estrogen. And like I've said before, often we give prasterone because we've got a lot of androgen receptors in our vulva, vagina, perineum, surrounding tissues. So you can give all the estrogen you like, but it's only going to half stimulate. You want to stimulate the estrogen receptors and the androgen receptors, and that's why often giving prasterone can really help as well. That can help with clitoral atrophy as well. Is it possible that I need more thyroxine when I'm taking estrogel? My doctor has no idea. It possibly. We monitor thyroid function tests regularly when people come to our clinic, and because the hormones work closely together, sometimes you need to change the dose of thyroxine, levothyroxine, when we alter HRT dose. I'm on HRT a year and my lipids panel are worse. Thought HRT helped. It normally does, but it might be that the dose needs changing, or you might need adding in testosterone. Testosterone can be very good for lipids as well. You talk about body bioidentical. Is Everol sequel body identical? The Everol bit is, so it contains estradiol. The sequel bit is not. It's a synthetic progestogen. The only way of having Everol with a natural progesterone would be having Everol with either Utrogestan or micronized progesterone capsules orally, or vaginal progesterone or rectal pessaries. You can't have it as a patch. Typical oral estrogen dose in perimenopause for non-absorptive transdermal. It really varies, actually. It really depends on how people are absorbing it. So usually we start between 1 and 2 milligrams, and then sometimes we might have to increase the dose. I started HRT 11 weeks ago, 10 years after menopause. I had low symptoms. Oh, I don't know what the question is here. Anyway, will testosterone help with anxiety? Yes, often it does. And our research from our patients show that anxiety, mood, also memory, low concentration, muscle and joint pains, headaches, motivation, urinary symptoms, these can all improve when adding in testosterone as well. I'm starting on Intrarosa. Do I have to use it at night time? No, you can use it in the morning if you want to. Can I use a hormone coil and progesterone by mouth? Yes, absolutely. And I've spoken about this before. HRT and Parkinson's, there's not much data. What's your clinical experience with Parkinson's? Well, Parkinson's obviously affects the brain. It can affect dopamine levels. It can have all sorts of effects on our neurotransmitters in our brain, and hormones do have a beneficial effect. We know that women with POI, premature ovarian insufficiency, the longer they are without hormones, the greater their risk of having Parkinson's disease. So it would make sense, wouldn't it, that replacing the missing hormones will reduce incidence of Parkinson's disease, yet no one's done any good quality studies. But there's certainly no harm if you've got Parkinson's disease to really be optimized with all three hormones, because they all have really beneficial effects on the brain, to see if that improves your Parkinson's. Can a GP prescribe testosterone? A GP can prescribe any medication that is licensed, even in an off-license way. But some GPs, it depends on where they live, it depends on their training and so forth. If my blood estrogen levels are high, can I still do low-dose estrogen for symptom relief? Well, as a general rule, our hormones really fluctuate, especially when we're perimenopausal. And so we sometimes see people who are not on hormones have very high estradiol levels. We measure them again and they're low. So they can really, really fluctuate. And often giving estradiol at a constant dose will stop that fluctuation if you get the right dose. If a level's high and someone's using hormones, then we often repeat the level and see. Just as a word of caution, if you're using the gel, it is a bit like fairy dust and it gets everywhere. So often we advise not to apply the gel until after you've had the blood test. I'm 51 and I have a doctor's appointment coming up. I'm not sure where to start asking. Well, download Balance, the free app, read the information there, do a health report, so answer the symptoms, and then you can download it and print it off and take that to your GP as a starting point. How do you know when to increase estrogen HRT if you're still in perimenopause? Well, it depends on symptoms. It depends often what your estradiol level is as well. Some people, when we start hormones, they don't feel any better. Their estradiol level's low, which suggests that we can increase the dose of the estradiol, or we can change maybe from the patch to the gel, or vice versa. Or it might be that they need to have testosterone if their testosterone level's low. So it's very, very individualized. And can those with severe active endometriosis and adenomyosis try progesterone alone in perimenopause? Yes, you can. Often when people have severe endometriosis, we give progesterone and sometimes testosterone and don't give estradiol. And I have done a YouTube about endometriosis, so it's worth looking at that. Recurrent UTIs, I'm not an HRT. Maybe you should be. We know that people who use vaginal hormones, especially prasterone, Rachel Rubin's got some great data about this. So women who use vaginal prasterone, Intrarosa is the other name, can reduce urinary tract infections, but also systemic hormones can. Really important when we know how common urinary tract infections are. Why is micronized progesterone vaginally off license? Is it safe? There's lots of things in medicine we prescribe off license. It just means that they haven't got the license for it, but it costs lots and lots of money for any drug company to get a license for a medication. So once they've got a license for one indication, they tend to just leave it as it is. And then as doctors, we can decide if we've got evidence and experience to prescribe something in an off-license way. So for example, medication we prescribe for children, for people who are pregnant, it's not licensed for that use or for that group of people, but we know it's safe, so we can prescribe it. And it's the same with giving vaginal micronized progesterone. 21-year-old dealing with cramping and heavy bleeding during period, healthy otherwise, what to do? There's lots of different choices. Really important to see one who understands hormones. Increasingly, we see young people in the clinic who in the past, I would have given contraception to. I'm more cautious about contraception because we know that there are risks of synthetic hormones, small risks, but if there's a safer alternative, often better. So sometimes we will just give some progesterone, and that will really help reduce reduce pain when people have periods, but also help make periods lighter as well. It's not a contraception, but it can really make a difference. Is there a greater chance of hair loss when taking testosterone? No, and I've spoken about this last week with Saj Rajpal on my YouTube live. FSH levels during HRT. FSH levels really vary. There isn't any good quality evidence that I've ever read, even to say that we should we should have raised FSH levels in women with POI, premature ovarian insufficiency. We often measure them out of interest, but there's no correlation really. In our experience, the better correlation is the estradiol, testosterone levels, and clinical symptoms as well. Pins and needles of extremities, is this a perimenopausal symptom? Yes, it can be. So the way that all three hormones really affect our physical nerves, and the way that they are conducted, the way the pathways occur, and a lot of people have pins and needles, which really can improve with the right dose and type of hormones. Watery vaginal discharge, can it be stopped? It depends on the cause. If you've got a discharge that isn't improving on hormones, vaginal hormones might help, but it would be worth seeing someone. Often we do a swab and an examination, make sure there's nothing else going on as well. I've got POI since I was 18, now 35, horrid hormonal acne. What do you suggest? Well, there's lots of reasons why people get acne. Sometimes it can be due to imbalance of hormones, so making sure you're on the right dose and type, really important. And I have done a podcast with Raj Sajpal talking specifically about acne, so it's worth listening to this. Please do a live on all the horrible so-called embarrassing symptoms. Okay, I will bear that in mind. Thank you. Is all progesterone natural in the UK? No, but there's Geprelex and also Utrogestan. Some people find the absorption of one different to the others, even though they're supposed to be the same. It's obviously how it's been made can really make a difference. Is there an age limit for the Mirena coil? No, people can still have it replaced. Some people really like having the Mirena as part of the endometrial protection for HRT, and they can keep having it. I'm on maximum dose of estradiol but not absorbing. What are my options? Well, you can have higher doses. Many people, including myself, have a higher dose of estradiol if we're not absorbing it properly. We don't start on higher doses, but for some women, we increase the dose if it's not absorbing and an alternative isn't beneficial. So it's worth seeing someone who understands hormones, who's got lots of experience, and we often do blood tests as well. Does HRT influence varicose veins in a negative way? Not if it's body identical, it can actually be in a positive way. It can be very useful for the way that the veins work as well. Brittle nails, part of perimenopause. Nails constantly flaking and breaking. Yes, that can be very common with all three hormones actually. But nails are actually a marker of other health reasons as well. So it's often when we examine patients, we always look at their nails because it can show iron deficiency as well and other mineral deficiencies too. So it's not always hormones, but it can be. Why is progesterone not given to women who've had a hysterectomy? Well, because people just think about progesterone associated with the womb, but it can be affected. Progesterone's important for other reasons as well, like I've said, and I've done a YouTube about it. Right, I'm going to answer one more question from here. I've got so many questions because I know that there's some in the chat here. How to figure out if mental issues are trauma or loss of hormones? What a great question. And there's no easy answer, but too often I speak to women and their trauma, their past experience is blamed on the way that they're feeling. And I think as doctors, we should do better than that. So if we balance hormones, make sure we look holistically at people's nutrition, their lifestyle, any supplements they might need, give it time, and then think about any influence of trauma. So often women are gaslit and told it's because of your traumatic past, this is the way you're feeling, and I feel really quite strongly that women shouldn't be told by that. Can you specify if it's this? I'm going to answer the questions here. Can you specify if it's okay to swap sequin patches to estradiol and 200 And 100 Nutrigest in the second part of the cycle, yes, but if we're giving it cyclically, it's usually 200 milligrams of Nutrigestan we give. I tried estrogen without progesterone and felt so wired I couldn't sleep, miss work. Is this normal? Yeah, it's often the balance of hormones. So sometimes people, when they've had progesterone and also sometimes testosterone added, I often say it's about a bit like a three-legged stool. You want to balance all three legs so your stool sits firmly on the ground. The same with our hormones. There's no point just having more and more of one and not thinking about the others as well. Somebody says, I'm using 250 patch and my FSH level is 0.3. I wouldn't worry about FSH levels. It's more about your estradiol level, actually. In perimenopause, do you recommend supplementing estrogen if no hot flushes, just skin and hair changes? It's not just about hot flushes. I've never had a hot flush. Many people don't have hot flushes. So it's looking at other symptoms as well in conjunction with hormone blood levels can be useful. I was refused progesterone when I said I get dryness during intercourse, have stress incontinence. I don't quite know why you were refused. It is available on the NHS. It's slightly more expensive than Vagifem, but it's not more expensive than going into a hospital with a urinary tract infection. So I would see another doctor and ask for a reason why they're not prescribing it for you. I'm menopausal, 53. Is there a way to naturally balance hormones? Well, isn't this an interesting question? Because our hormones are natural, actually. We're not actually designed, evolutionary to live so long without our hormones. So we just balancing them in a natural way with body identical hormones, the same way as if someone had an underactive thyroid gland, we balance them with thyroxine, or type 1 diabetes we balance with insulin. It is just another hormone. Estradiol is, and progesterone, testosterone. We need to think those as natural hormones. And I did talk more a couple of weeks ago in my YouTube live about hormones. When you get estradiol via the patch or gel, does it convert to estrone? So there will be a little bit of conversion, but it will mainly stay at estradiol. Estrone is the pro-inflammatory type of estrogen that's made in our fat cells and made elsewhere in our body, but it's often made more when people are menopausal without hormones. If they've got estradiol, then their body will make less estrone actually and more estradiol. Is there such thing as estrogen dominance? Great question. Lots of people talk about this. This is often the imbalance of hormones. So you can have sort of relative estrogen dominance if you haven't got enough progesterone or you haven't got enough testosterone. A lot of people lose their progesterone for sometimes 10, 20 years before they lose estradiol. So in the early perimenopause, for example, people might be quite progesterone deficient. So even though their estradiol level might be going down, it doesn't go down as quickly as progesterone. So there will be a relative estrogen dominance, but that doesn't mean estrogen's bad. And rather than trying to reduce the estrogen, what we try and do is give back the progesterone and sort that balance out, or the imbalance out, really. What do you do when your blood pressure goes down too far after starting HRT? Well, this is because HRT can cause vasodilation. It can affect our RAS system, our renin-angiotensin system, so lower blood pressure. So if that happens, I would just maybe titrate back, so go on a lower dose and then gradually increase. A lot of people we see we can deprescribe, so these women can come off their antihypertensive medication as well. How do you explain that some women age perfectly without HRT? Of course they do. I mean, lots of people age perfectly. We need to be thinking about reasons for giving HRT. One is for symptoms and the other is to try and reduce risk of diseases. A bit like we give blood pressure lowering treatments to try and reduce risk of a heart attack. We give HRT to reduce risk of heart attack and osteoporosis, but not everyone will get a heart attack or osteoporosis. Not everyone will get symptoms. A lot of people are well, but there are a lot of women who aren't. We know 1 in 2 women have osteoporosis. We know the leading causes of death in women are cardiovascular disease and dementia. We know that sepsis, around 30% of sepsis is due to urosepsis, urinary tract infections. So taking HRT is a choice. Some people decide that they don't want to take it, that's fine, but I think it's important to know there are risks of avoiding hormones, and the hormones are natural. They are more beneficial than risks, and actually the risks are associated with the synthetic hormones, not the natural hormones. Is it possible to be over-estrogenized? I feel I have a lot of symptoms relating to it. I'm on Mirena and estradiol. I still bleed in periods 3 weeks at a time. So if we start in the perimenopause, sometimes we've got our own hormones. So you've got endogenous estradiol and exogenous, if you like, through the patches or gel. So there might be more estrogen than the body needs. And then with time, as the hormones endogenously internally decline, people might need the dose changing. But also, we see women who have often come from other clinics actually, and their dose of estrogen increase, but they haven't been looked at progesterone or testosterone. Even if you've got a Mirena coil on, you might benefit from having some progesterone. And so we look very carefully at the doses of all three hormones. It's not just the one in isolation. So it's very important to think about that. Is there a cream body identical progesterone? So there is, but it's compounded, so it's not made by a drug company. And for some women, it might be beneficial to have a progesterone cream. We wouldn't use a progesterone cream to protect the lining of the womb from, if someone's having estrogen, they've still got their womb, because there isn't any evidence or data. We can use progesterone if we don't want to use it vaginally, either rectally or vaginally as a pessary, and that way you've got a good amount going into the body to protect the womb as well. Could you tell me the minimum effective dose of estradiol for bone loss prevention? Well, it's not the dose, it's the absorption. So we like to get levels between 250 and 1,000, and that will probably be good for bone protection. I've tried HRT, but it made my endometriosis worse. Watch the YouTube I did about endometriosis, and think about testosterone and natural progesterone before thinking about estradiol as well. Sometimes synthetic hormones might increase inflammation and make endometriosis worse as well. I cut my patch in half, which is stopped. Is it okay to do so? Yes. I mean, it's not licensed to be cut in half, but usually it's fine. What can lower SHBG? Mine is high. A high SHBG is actually a marker of good health. I wouldn't worry too much about it at all. My mum is 69. She started taking spray. She developed cuts around her anus. The menopause doctor advised to use half Everol Country, but it didn't improve. She stopped HRT, but she did feel improvement. Well, I mean, she'll need to see someone about changing the dose and type. Round the bottom is similar to round the vagina and vulva, and it might be that she would benefit from some local hormones, especially progesterone, thinking about testosterone, lots of androgen receptors around the anus as well. Hair, estradiol, progesterone, hair loss. Listen to my podcast with Saj about hair loss, because sometimes it's not due to HRT, it might be something else. If it is, then there are things that we can do to reduce hair loss while people can continue taking HRT. I've had some spotting. Well, then it's often we do a scan. Usually it's not due to any serious condition if people have bleeding on HRT, but people might have fibroids or polyps, so it's worth just having look at that as well. I'm at the point on the day after I shampoo, I don't want to leave the house. What's this shampoo for? I haven't got the whole thing here. I'm not sure. Sorry. I want to just get on with some other questions. Gosh, there are a lot of questions here. I will do another one. HRT not working for PMDD. Really important to have the right dose and type of hormones. And sometimes, we give a higher dose of vaginal hormones, which can be very, very useful. How do you decide how much? It's really, really important. We've got a lot of, we have a lot of clinical experience and knowledge. And also we often do testing of levels as well. And sometimes, in medicine, we don't always know. We try something and see if it helps. Hormones can take 3 to 6 months to have their full effect. So we don't usually keep trying the dose and changing it all the time. Many of us, including myself, become very impatient when we start taking hormones because we just want to feel better. And it's really frustrating when we don't. But we have to be patient. Then we have to be led by expert opinion. We have to think about changing the dose. We have to think about any short-term side effects compared to long-term side effects. We also have to remember that the hormones don't last very long in our body. So if I took my patch off now, by tomorrow night, the estradiol wouldn't be in my body any longer. We're constantly getting new cells. Our whole bodies are replicating and making more and more new cells. So if someone had an adverse reaction or a side effect to a certain dose or type of hormones, then it's not going to be there forever because our cells are regenerating and changing, and often symptoms that people get that they think are side effects can often be related to suboptimal hormone replacement. So we need to remember that as well. Someone's saying, after breast cancer, ER positive last year, 9 weeks ago, full hysterectomy, taking tamoxifen, really struggling. GP told to wait to oncologist, that's ages. So I'm really sorry to hear this. If you go onto my website, Dr Louise Newson, drlouisenewson.co.uk, and search breast cancer, I have written quite a detailed article about breast cancer because there are lots and lots of choices actually for women. When people take tamoxifen is a SERM, a selective estrogen receptor modulator. So actually, women who take tamoxifen, some of them have higher levels of estradiol in their blood, which a lot of doctors don't realise. Sometimes we do give HRT to women who are on tamoxifen, but we also sometimes just give testosterone on its own. There are options, but whether your GP is experienced enough or not, I can't say clearly, but it would be worth seeing somebody. Often people come to our clinic, then they might start the right hormonal treatment, and then the GP carries on with us prescribing as well. What if I'm intolerant of progesterone and still have a womb? Well, listen to my YouTube about progesterone. I use synthetic hormones. I know not the best but cheapest option. I do completely understand that cost is a real issue, and it shouldn't be. It shouldn't be that our natural hormones are more expensive than synthetic hormones. There's a lot that needs to change for women's health, and that's why it's really important that we are given the options and have the ability to make choices that are right for us, and that we as patients, rather than me as a doctor, but we as patients need to really help with shared decision making, because increasingly doctors don't have the right experience, they don't have the right knowledge, or they might have some vested interests. There are a lot of doctors who work in menopause, and menopause clinics and menopause societies are funded by various pharmaceutical companies. So we have to be really careful that all our evidence and knowledge comes from an impartial place. And I think as patients we need to take responsibility to getting more information so we can work out what's right for us. I just wish it wasn't so difficult for so many women to receive the treatment that they want, and I really hope things can improve in the future. So I know I've spoken quickly. I have gone through a lot of questions, and I'm sorry that I haven't been able to answer all of them just because of the time. If you found this useful, go onto my Instagram, put in the chat, in the comments whether you found it useful or not, and also other topics that you want as well, because I'm really happy to give my time on a Sunday for others, but I want to make it as most useful as possible. So the more I hear back from you, the better. So enjoy the rest of your evening if you're in the UK, or rest of the day if you're elsewhere, and thanks for all your support and encouragement as well. It really means a lot. Thank you.